James Burgess, Sports Medicine Diploma, this is lumbar spine examination. What we start off with on lumbar spine examination is a good inspection of the spine. So that's what we're going to do now. So you just turn yourself towards the camera there. So what we do is we lift up the shirts in this case, and we're just having a look at the spine, literally from the back, to see that the alignment is correct. And in this case the alignment is correct. And then just from the side, that's it. So if you just go like that, and then just from the side on to see if there's any problems. So we've got the normal thoracic kyphosis. In this case, it's normal. We're looking at the lumbar lordosis. Again, that's normal, and also there's a slight kyphosis there. Again, in this case, it's normal. There's no scoliosis present either. The other thing is to see what the alignment of the spine is like when someone's walking. So if you wouldn't mind just walking towards the door there. So looking at the gait, is the gait normal? Does the spine look normal from the back? From the side as well? Yeah, everything looks normal in that case. The other thing to do in this situation is just to see if there's any issue with the Trendelenburg test. So we're just going to do a very basic Trendelenburg test. So if you turn around towards the camera there. What we're going to do is, I want to look at the back here, and so we're just going to do hip flexion. So we're just going to lift up the leg on the right side like that. So just bending your leg up like that, just seeing if there's any pelvic tilt. So the pelvis actually is in line there, there's no problems at all. If you do the same on the other side, yeah, that's not too bad, there's no major issues there at all, so that's not a problem. So we've assessed for that. Obviously, if the Trendelenburg test is positive, but could indicate on the affected side, what would happen is there would be one side would go up, the other side that is the one side that goes up, that side is unsupported, and that could tilt to the side. That could indicate an unstable hip, or it could indicate a weak gluteus muscle on that side. So unfortunately, it's obviously not present in this case. The other thing to do now at this moment is just to inspect the back to see if there's any problems with it. So just get you to lie down on the sofa there, and if you just turn towards the left-hand side here, what we do is bring up this up here, and we're just palpating the spine to see if there's any issues there at all. So first we just go down so we're just going for the lumbar spine here. So any problems at all when we press on here?
No.
No, so this is obviously the spinous processes at the front here, right down the back. And then just to the side of that, so actual facet joints, we need to press a bit harder there. Any pain there at all?
No.
No, and we just do the same on both sides to make sure there's no problems there. And just lateral to the facet joints is the muscles there. Any pain over the muscles there at all?
No.
That you're aware of? No. So that's fine, there's no issues with that at all. Okay, so I've done a palpation. What we're going to do is do some movements. We've done inspection, palpation, now some movements of the spine. So the first thing is, if you'd like to stand up for me there. So what we're going to do is ask to do some lumbar spine flexion initially. So if you'd like to touch your toes for me, that looks normal, but what we want to check is to make sure that that is not coming from the hips, it's actually coming from the spine. The only way to do that is I'll just get my tape measure. If you'd like to come back to the neutral position. Is going to get my tape measure. We're going to find the posterior spherical spine. We're going to find a point that's 5 centimetres below that, 10 centimetres above that, and then we're going to do that again. And obviously that should increase beyond 20 centimetres when that is done. So we're just going to do that now. So just quickly just fill the areas there. So we've got an area there. That's roughly the area. Yeah. 5 centimetres below that. There. Okay, yeah, okay, if you'd like to just do the same thing again for me. So we've got those 2 points there, that's increased to over 20 centimetres, so there's no problem there. So the next thing to do is doing some extension. So if you'd like just to lean back for me. Again, there's a good range of movement there. If you'd like to go backwards again, but actually turn more to the right side initially. So when we're doing that, we're putting some strain on the facet joint. Any pain at all? No. There might be some pain, there might potentially be some nerve symptoms in that situation. I'd like to do the same on the other side, please. Again, there could be an issue with that. While we're in this position, we could also just make sure that the SIJ joint is functioning correctly, and then we also might palpate for the joint as well in this situation as well. So if you like just to bend up your hip for me there, so what we're doing there is we're putting our finger on the posterior splenic spine. So let's put your leg that straight. So we've got an area there, that's roughly there. So you like to bend that up. We're just looking for rotation of that joint, which we have got a little bit of rotation posterior iliac spine. If there wasn't rotation of that, that could mean that the sacroiliac joint is not moving correctly and there's an issue with that joint. So some more specific tests for sacroiliac joint issues would be palpating the spine. So if you'd like to go back on the bed again and tilt again to the left hand side. So if we had any concerns about the sacroiliac joint, we'd come down to this point here, we'd find the sacrum, which is below the lumbar spine obviously, and then just go to the side of that and just palpate in this area here. Any pain there at all?
No.
Obviously got two joints, one on either side. Any pain there?
No.
If we had any concerns about the sacroiliac joint, we might try a lateral compression test. So that means we're just putting a little bit of pressure just above the buttock here, just to see if there's any pain. Any pain there at all?
No.
And we repeat on the other side, especially if we had concerns in regards to that. That's fine. So if you'd like to stand up for me. And then the final movements will be lateral rotation. Okay. So if you'd like to just make your arm go down to the side, down your leg on the left hand side initially. That's actually quite a good range of movement. Any pain there at all?
No.
No, so looking for pain or lack of range of movement. And then on this side, not an issue there at all. So that's actually quite a good range of movement. The final movement is, if you'd like to sit on there for me, please. Ideally, it's better. Patient's a bit lower, to be honest. It's doing a bit of rotation. So if you'd like to just keep your hips as they are, and just try and rotate to the side there. Okay, and then rotate around the other side. As I say, it's easy to see the patient from above, but there is, some rotation there. I'm not too concerned about that. If you'd like to just lie with your back on there. So we've actually done, we've tested the movement, we've inspected, palpated, we've assessed problems with the lumbar spine and sacroiliac joints. What we now need to do is assess for the myotomes and dermatomes of the back, and also looking to see if there's any neural stretching. And there's two different tests that we would go for the neural stretching. First would be a sciatic nerve being affected, or potentially any of the other lumbar spine nerve roots particularly, but could be sciatic nerve. So what we do that is a straight leg raise test, okay? So I'd like to bend your leg up for me. It's not ideal with these trousers on, obviously it's slightly better with shorts on. I'd like to bend the leg up for me. Any pain, tingling, any issues at all with that? No. So if there was limited ability to straight leg raise, if there was any neuropathic symptoms below the knee, that could indicate an issue, a positive straight leg raise test, and that there is an issue with the nerves being impinged or irritated. So the same on the other side as well. Okay, so that's for the straight leg raise. Again, that's normal there. So if you'd like to turn around for me onto your stomach for me. So actually for the femoral nerve, what we need to do is hip extension for that. Okay, so if you'd like to lift up the leg for me. Any numbness at all at the front of the leg,
No.
in your thigh area here?
No.
No. Again, we might, as I say, expect some numbness or irritation in the thigh area. Can you lift this leg up for me?
Yeah, that's fine.
So there's no issues with that at all, so that's fairly normal, isn't it? So if you'd like to turn around for me, so we're now going to assess for the myotomes. The first myotome is L2, and L2 is hip flexion. So if you'd just like to lift up your leg for me straight, so there's no problem with that, good power, no issues with that. And the same on the other side, absolutely no problems there, good power there. And then L3, that is the myotome for knee extension. Okay, so if you'd like to bend your knee for me, I just want you to straighten your knee out for me. That's it, like that. I'm just going to resist that. So again, that's normal, nice power there. Same on the other side there. That's fine. If we could just take your shoes off very quickly there. Sorry for the delay here. That's great, that's fine. come back on there. And then L4 is ankle dorsiflexion. So if you'd like to bend your ankle up for me, bend your foot up. L5 is a big toe, so just a big toe there for me. Might just take the socks off as well. Just quickly do that. Whip those off. It's a bit easier to do the sensation as well. So if you'd like to just put your big toe up, same on the other side to compare. So that's L5. And then finally S1 is ankle plantar flexion. So bend your ankle down, bend your ankle down. And then what we to conclude with is the dermatome assessment, okay? So the dermatome, so L1 is into the groin crease here. It's got the trousers on, but certainly we can make an assessment here. Any problems here at all? No. L2 is this part of the thigh, anterior part of the thigh, into the medial area here. Any issues on either side here? No. L3 is this part of the thigh, so the distal thigh, moving across into the anterior knee. Any problems here? No. L4 is usually on the medial side here. Yeah, problems here? No. L5 is just down here, all the way onto the front of the foot here. Yeah. And then S1 is the edge of the foot here. Any problems here? No. No, that's fine. Yeah, that's and then finally, if we had any concerns about an SIJ issue, a final test that we could do to finish off is, if you'd like to stand up for me, please. And is the stalk test. So if you'd like to put your knee up for me there, and then just like lean backwards. So this could cause pain in the SIJ joint there, and then the same on the other side. This is just a final special test that we're just mentioning, as you could use that if you had any extra concerns about the SIJ joint. So that concludes our examination. Thank you. Cheers. Thank you.